And hello, I'm Dr. Ruth Roberts, the original pet health coach. And with me today is Luminara Serder, who is a neuromodulation technique practitioner, amongst other things. But in her real super life, she is an autism transformation expert, helping parents to discover and address the root causes of their children's challenging autism behaviors so that a child can be calm, happy, and develop to its peer level and gain independence, and so parents can feel competent, empowered, and happy. She has trained as a scientist in genetics, cell biology, biochemistry, and finally as a functional nutritionist and holistic healer. She works with clients throughout the world using nutrition, opening body systems, and removing toxic buildup to help shift autism behaviors. I will drop a link to your website, Luminara, so that folks will know where to reach you. And some of you may be thinking, well, Dr. Ruth, I'm here because I'm worried about my dog or cat. And what I will say to you is that sadly, dogs and cats are often the canary in the coal mine for what's going on at home for children. And likewise, if we can understand part of what's going on for children that have neurodiversity or challenges around that, then I think we can start to understand a little bit more about how to support our pets too. So, Luminar, welcome. I am so glad you're here. And one of the things I think it's just out of the box. Everybody's searching for the magic bullet for what is causing the autism. But what do you think is this underneath all of these behaviors that we sort of designate as being autism?
I think autism is a collection of a lot of dysfunction in the body, a lot of biochemical dysfunction, might be some emotion and trauma and ancestral stuff thrown in there. And then I consider this soul comes into a body and has a soul mission, and it's like, great, I have this mission in life. And then it's like, wait a minute, this body isn't working. What's going on? And I feel like we are just living in a more and more and more and more toxic world. I don't know if you talk about that with pets. I imagine you do. And, especially if they're out drinking whatever water on the sidewalk or who knows what's in it. Our kids come in to, the womb basically, and mom's body says, wow, extra garbage bag. Let's dump all these toxins in here. So if a mom is toxic, while she's pregnant, and so many people these days are seeking IVF because there's infertility because they can't get pregnant, and it's because their body's toxic. Among other things. So they do this IVF and they finally can, have maybe a couple kids in the womb, and they're both come out autistic. Well, it's because mom's load of toxins got in them. Just they're diminished at the start, and then they don't know how to detox properly their body systems. And so you see it come out as neurological dysfunction, as behaviors.
That's amazing. So, and I'm sure that some of the toxins are things like heavy metals that are and especially mercury and lead that are going to create changes in brain function. But what are some of the other mechanisms you're seeing? What do you think the main mechanism is?
I don't think there is a main mechanism. That's the thing. I work for a nonprofit called Documenting Hope, and our theory is there's a total load theory. So if you picture a bucket and you have just a little bit of water in there, not a big deal. But if the bucket's full and overflowing, where the water has to go somewhere. So that's kind of the toxic load theory. It's like these kids' buckets are really full. So it's not just one thing. It's pesticides and herbicides and plastics. There's been so many studies recently that show that there's glyphosate, which is the main ingredient in Roundup, and heavy metals in our kids' lunch at cafeteria meals at school, in fast food, in packaged foods, in everything. And there's cadmium and aluminum, and I'm finding things like uranium, tellurium, thallium. We maybe have never heard of that, but you see these on lab tests now. It's like, where'd that come from?
Wow. I mean, that's like stuff I remember learning in chemistry, but yeah, and learning that they are potentially toxic, but holy smokes, so those are actually showing up in lab tests now. That's
And more
amazing.
than one. Like you have, I had a kid the other day with thallium and tellurium and I think cesium. And well, this is a little guy that grew up in the Middle East. And, you have these winds sometimes during the year that blow all the stuff through the Middle East and like all the wars. What's the stuff that they used in there? Like what is this stuff? Where is it coming from? It's in their food, air, water. And not to scare people, but this is just the state of in which we live. So we all kind of have to live a detox lifestyle. And it's not just our kids, right? It's
No,
us,
it's
it's our
all of us.
pets, it's all living things on earth.
Yeah, and I think what you said is critical too. It's not just one thing, it's multiple things. You just mentioned one child having 3 or 4 different heavy metal contaminants, but the effect isn't 1 plus 1 equals 2, is it?
No, it's not. And nobody really knows what that effect is. And then you have mold. A lot of people have mold toxicity on top of that. And one more thing I want to say, in 2004, the Environmental Working Group did a study of 10 Americans, looked at umbilical cord blood, and there was like 287 toxins in the umbilical cord blood. So one toxin we might know, oh, this is a carcinogen, but if we have 200 plus chemicals in the body, we don't know the synergistic effects of that. So we're basically blocking out, kind of knocking out the detox systems that are meant to get rid of this stuff in the first place. So there you have it.
Oh, that makes sense, and that makes sense why we're seeing so many of these children show symptomatology either shortly after birth or very, very young in life. So, thank you. Thanks for helping explain that. This is the same concepts that we're seeing in our pets, by the way. I mean, we're seeing dogs develop malignant lymphoma all over their bodies as early as 6 months of age. And I think this is part of what's happening. And dying 2 months later because their systems are so overburdened that there's just no way they could control the progress of these cancer cells. So, having said all that gloomy stuff, what is the first thing a parent should do to help their child?
Well, most pediatricians will tell you that it's okay to have your child poop every 2 or 3 days, and that's not a big deal. But, have you, has anybody with a pet allowed them to not poop every day? Like, how dangerous that is? We have to be eliminating. And most of these kids are constipated. I don't know if pets get constipated. I suppose they do.
They do. They
Yeah.
do. Yeah.
So we have to eliminate our waste or else it fills that bucket. So that's the biggest thing is I find a lot of kids are constipated and then their gut needs help. They need the right microbiome, and I'm sure you do that with pets. So there's just it's very similar.
Yes. Yeah, and honestly too, I mean, functional medicine concepts, I had to take them all from the human side and figure out how to adapt them in the pet side. And where it made the most sense was protocols for children because their pathways were more similar to what dogs and cats could handle. So yeah, it's just awesome stuff. So how so constipation is a big thing in getting gut health, but, when you start to work with some of these children or you start to hear from their parents, what are the behaviors that you're seeing or that the parents are describing?
It's a really wide range, and each child is unique and individual, depends on, their history, their genetics, their toxin load. So some, more severe autistic kids are banging their head on the floor or against the wall or hitting themselves. They do a lot of behaviors called stimming. So it might be hand flapping or rocking. This is a sign that there's discomfort in the body or that they're so anxious inside that they need to have an outlet. A lot of kids are nonverbal, so they're not speaking, and parents don't know how they're feeling or what they're, if they're sick or not, or if they're hurting. Of course, there's like a lot of bloated bellies, a lot of gut type issues where kids might push on the armchair or the couch, the end of the couch, like helping their belly feel better, a lot of gas, diarrhea, constipation.
Wow.
And then there's like dyspraxia. So there's all these disses, right? Dyspraxia, dyslexia. So dyspraxia is when you can't control the motor movements in your body, or they're mixed up, or sometimes kids can't cross the midline, or their initial reflexes that we have as babies they're not integrated. So that we have to integrate primitive reflexes before further parts of the brain develop. So it really ranges, and it depends on each child. Some kids have meltdowns and can scream and cry for hours. Some kids wake up at 1, 2, 3, 4 in the morning and they're up for hours. So the poor parents are up with them. And this is a sign of a lot of discomfort in the body. And the most common thing that pediatricians say, a lot of pediatricians don't know what to do. They say, go do behavior therapy, because the autism is seen as a behavior disorder. Yeah, it's a behavior disorder because there's something underlying that in the brain that isn't working. It's inflammation of the brain and inflammation of the gut. And so they tell them, I don't know much about the pet world about training, but they'd say, go do behavior training. It's kind of like, some forms of dog training. Go fetch the ball, come back, you get a treat. And they actually give treats to the kids, like
Wow.
the Pavlovian response, which helps them learn certain things in their brain, but they can be really robotic at it. And like I've heard from parents that they've been working with behavior therapy for a year to try and get the child to appropriately say yes or no. So there's something not happening in the brain, and they still don't get when to say yes and when to say no, until you
Wow.
start cleaning the toxins out, and then they start responding better.
Wow. So that makes total sense, because what's happening, we have a lot of our pet health coaches that are dog trainers, and they're like, I get these dogs and I'm doing all the things that I know that works, and it's not working for these guys. So
Mm.
again, real similar, because if you've got a bunch of stuff telling your brain or making your brain do weird things, or your gut's making neurotransmitters that aren't serving you, yeah, it's the same thing with these
Mhm.
guys. So crazy stuff. So then, besides sending the children off to a dog trainer, essentially, what have you found is really key to shifting behaviors in a direction that helps this child actually integrate a little more with it, his or her surroundings, and to be able to develop easier?
Well, let's take a scenario of someone whose bucket is really full. They're very concerned with the inside, right? There might be a pain here, or some discomfort, or like some tickly sensation inside. So they're very inward and state of themselves. And parents want them to be social and have eye contact and all this stuff, and they can't. They're I think they're inward focused. When we start pulling the toxins out, so when we get them pooping every day and start binding up toxins and really pulling them out of the body instead of having them recirculate, we see reduction in anxiety. We see more eye contact. We see them kind of come alive and become more aware, because they don't have to focus as much on the inside of the body. So now they can start looking outward and go, oh, that's what's out there. Oh, you're out there. They start responding to their name. Some have even words. It depends on where they are in their process. It's a long process to pull all the toxins out. But it's really starting with the bottom of the body and getting the toxins out from there, and then letting eventually we want to pull the toxins out of the brain and stop the inflammation. But you have to have everything else open in the body before you pull that stuff out. So it's opening up the whole body. And then I do energy work, which is the NeuroModulation Technique. And I've been doing that for 17 years. That's actually how I got into the health field. I did NMT. I went to someone who did NMT on me to eliminate my allergies, and my vision spontaneously improved, which had never happened in my life. And so my lens prescription went down by 33% just by, going to some NMT sessions. And that's what got me interested and fascinated. And then I was eliminating people's allergies, and you're just kind of rewiring the inside of the body a little bit.
So how does that work? What does a session of NMT look like?
Yeah, so it's a really hard concept to understand because it's kind of so simple. And if anyone's heard of this manifestation, the laws of manifestation and The Secret, and how our thoughts create things. And if you know who Bruce Lipton is, and he says our beliefs matter. And the placebo effect is another example of this. So we create with our mind and our thoughts. So NMT is literally an intention. It's a therapeutic, it's a very specific therapeutic intention. So let's take a concrete example. If I'm working with a child with constipation, or you're working with or I'd be working with a dog with constipation, similar, I would muscle test. So do you want me to explain muscle testing probably?
Sure. Yeah, that'd
Yeah.
be awesome.
Well, muscle testing is a way of gauging a strong or weak muscle to get a yes or no answer from the body. So if you were in my office, you would hold your arm out like this and give me resistance, and I would ask a question and push down. And if it's a no, I'm going to get resistance. But if it's a yes, your arm's going to easily go down. Usually, no matter how hard you're trying, we don't want you to try harder. But and for a pet, you could use a surrogate. So you could have
Yes.
a human there touching the pet, and you can get the information from the pet. So what I'll do is muscle test, and you can ask the body any yes, no question, right? You're just going to get an I or a no. It's digital, right? A yes or a no. And
Right.
so the whole format of NMT is questions to ask the body. So for constipation, I might ask, is there awareness of everything contributing to this constipation? If not, I'm going to say, okay, let's create awareness of all factors that are contributing. So it could be the smooth muscle doesn't have enough energy, right, to push the poop. It could be there's ammonia that backs up that doesn't let the muscles move and the poop go through. It could be certain microbes in the gut. It could be what's called the motor migrating complex, which is, part of the nervous system that's in the gut that it could be stuck in one way or another. It could be there's too much anxiety, so there's a holding, right? And we're in fight or flight, and you're not going to poop if you're in fight or flight. You need to be in rest and digest. So there's all these different reasons, and we ask the body, is it this? Is it this? Is it this? Is it this? And it's always a combination of things. It's never one thing. Is it emotions, right? Is it, so we ask all these questions. Is it a sensory motor thing? Like the brain just isn't picking up the signal, or a reflexive thing? So we ask questions, and then we say, can we correct this? And then there's a very specific, almost scientific way of saying, can we get we can find which sensors aren't working. We can find if it's, which errors it is. So there can be something called facilitation, where a signal is being, amplified. There can be something called inhibition, where a signal is being diminished so much the brain can't handle it, can't hear it. So we just look for all these different errors, and then correct them and say, hey, body, this is what you look like. Picture A, would you like to look like picture B so you can poop? And the body's like, yeah, I'll take that.
Yeah.
And so we
Wow.
literally, the correction is we tap down the spine while we're basically, giving the nervous system an adjustment. So I have people breathe in, breathe out, and then they pant. And I'm tapping my chest right now, but I would be tapping down their spine while they're breathing. And it's just anchoring that intention into the nervous system. So it sounds a little woo-woo, but it's literally our thoughts creating it.
That is amazing. No, and I totally get it. And so that's a way to have a conversation with the body of a child that cannot verbally converse.
Mm-hmm.
And when we were speaking earlier, you said you've done this. I think Kyle likes this idea. You said you've done this for dogs, cats, animals, garden, the whole 9 yards. So how does that work when you're working with pets?
Well, pets are so much easier because they don't have all the cognitive belief stuff that we have that block us from healing. And I have found that pets tend to take on owners' characteristics. So, yeah, if you're clearing the pet, then the owners have to kind of look in the mirror and say, okay, what is it that I've been doing that my pet's been taking on? I've done informational vaccine pathways with like cows, alpacas, I think some dogs. I can't remember what I used to work on with my cats. Sometimes behavior things like I don't want them to scratch the furniture or something like that. and autoimmune stuff with dogs I've worked on. So it's really whatever, you can work on anything in the body.
That makes sense. And Monica's asking if this will work with epilepsy, but it sounds like pretty much anything, any concern there is, this technique will work. It's just a matter of going through the right questions. Is that fair?
Yeah. So, Monica, for epilepsy, what I would do is ask what's contributing to this. And we know in epilepsy from brainwave things that the brain patterns are not cohesive or coherent, right? So we might do some brainwave work, or we might say, oh, there's toxins and they're creating this inflammation, which creates these brainwaves that are off. We just ask the questions and find out what it is.
Wow, that's cool. So, and she's also asking if this is similar to EFT or tapping, and it sounds like kind
Yes
of, but
and
not really.
no. I mean, yeah, you're still using the energy flow of the body, but it's way more specific. So what quantum physics, it's based on quantum, physics, and what quantum physicists have found is that the more specific you get about something, then the more like honed in you are, like looking through a what's the spyglass thing. If you're looking out at the whales in the ocean and you look through
Yeah,
the binocular type things, you're going to see better. So that's like the honing in, so more
right.
specificity. Sometimes quantifying, so getting numerical values for things, and I think there was one other thing, but it's definitely specificity and quantifying are two things that help kind of. It's kind of like having a GPS coordinate on a map versus just saying North America.
Right on. So you can really hone down to a
Nitty
very
gritty.
strict level, right? And with EFT, it's more sort of clearing. Um,
It's more emotional with
yeah,
EFT, and this is
yeah,
more, of course, emotions affect the body, but there's also, I look at neurochemistry and I'm a biochemistry geek, so I'll look at the biochemical reactions and
right.
methylation pathways and, like all this
The
stuff.
whole, all the things in functional medicine that tend to become an issue and create uh, dysfunction. That's
Yeah.
amazing. So it sounds like, and Laura's asking if you're tapping down the entire length of the spine,
Mhm.
and and it sounds like you're just clearing the entire nervous system, literally from stem to stern.
Yeah, but I'll tell you something, Laura and Ruth, is that I have an NMT practitioner friend who uh, one of her patients couldn't come in or something. And she said, well, she did something to clear an allergy or something. I don't remember. Or a heart thing. And he said, oh, I want some more, but I can't come in. And she said, oh, just imagine your down your thumb is your spine, and tap down here and breathe in, breathe out, panting, and say, what Luminara said. And like, so to bring your subconscious and your conscious mind back to the time of the treatment. And I've done this with people too. And I remember working on this guy with allergies, and I said, yeah, if you start feeling stuffy, just you could tap here on your chest, you could tap here. The idea is you're evoking this same therapeutic intention to your nervous system. And he would tell me the allergy symptoms would go away like that, like in a second. So does it have to be the
That's
whole spine? It can be representations of the spine. You just, I think doing the spine is just again, another metaphor for the
makes
placebo.
sense. Makes sense. I remember reading an article uh, about a young woman that was undergoing chemotherapy, and I forget for which cancer, but essentially what she did was take her symptomatology, sort of the Western medicine way to use this idea, but she took her symptomatology from the chemotherapy, which ended up creating a positive result in terms of shrinking the tumor, and then would replay that. Never took another dose of chemotherapy and ended up clearing her tumor.
Wow.
So she just emulated the medication's actions over
Mm-hmm.
and over and over, and she would not feel good. She would get the side effects, but
Mm.
she ended up clearing her cancer. So amazing.
That's amazing. That's the power of our minds. Dr. Joe Dispenza, who maybe some people have heard of, he's studying this and what happens in the brain and how healings happen. And he healed himself from an accident, a spinal injury, I believe, where they said he'd never walk again. And
Yeah.
listening with the Moshe Feldenkrais, the Feldenkrais method, he also was disabled, and he just was picturing all the little neural networks and picturing them being being fixed. And if you've ever done a Feldenkrais class, that you could do a whole hour class on just what your tongue feels like in your mouth. So it's micro awareness to the point of you're looking at everything, and then you can fix things, in your body.
That's amazing. I had the pleasure of listening, and I apologize, I can't remember the guy's name, but the main researcher for Dr. Dispenza. And what he said, he was talking about the results they're seeing when they pair an older person, and a younger person together as meditation buddies, kind of similar to the idea of the rats that they physically hooked up and then later just did blood exchanges. And what they found was that the older person had younger appearing results in terms of what they were measuring physiologically, but the two people paired together, the good news is the younger person didn't age, but the two of them matured their ability to meditate together so much faster than people that were unpaired. And this was all simply by having meals together, spending their free time together, through this week-long retreat with Dr. Dispenza. So just astonishing what our brains can accomplish if we have the tools to do it.
Yeah, well, that reminds me of this concept called entanglement. Dr. Dean Radin, he did experiments where people would meditate for 15 minutes, go in separate rooms, put on brainwave measuring equipment, and they were already in coherence. So what one was experiencing, the other is experiencing. So I imagine that happens with our pets too, right?
It does. And that's part of what I talk about. If we're running around like chickens with our heads cut off and unable to stop the fight or flight, being in the sympathetic state. Yeah, I've been out of town for 2 days, so I was like, "Oh, you're back." But if we're unable to shut that off, our pets can't either. And so that's what's really critical, is that if we're in that state, that we take time to turn off all the bells and whistles and the notifications and breathe and drop ourselves down. These guys will too. And then conversely, as you said earlier about, pets mirroring what's going on in the people's lives, if we can stop and sort of say, okay, I am reading the news way too much. It's getting me jacked out. I need to stop it. And then look over at your pet and see what they say. So, I mean, it's amazing, but we are entangled because they can come into our fields. Hopefully we're in coherence more often than not, but if we're not in coherence, they will definitely feel it.
Yeah, and it's the same with kids, just exactly what you explained with the pets. If the mom's anxious and sympathetic and running around, and their kid's nuts and crazy and they're running around, like one of the things I recommend is just sit down, sit next to them, and do like the vagus breathing, which is like 4 counts in, 6 counts out, or whatever you're inhaling or exhaling, 2 counts longer, to get your system calmed down, and the kids calm down because they're feeding off of us. They're getting in coherence with us.
Right on. So, one thing, I just want to bring this up because it's so frustrating. So Caroline is one of our holistic pet health coaches, and she said, she had some high cadmium levels when she did her metal test. Where is this coming from? Is it mostly in the water? And what are your thoughts on that one?
I think cadmium is also in batteries and electronic equipment. I'm not sure if it gets in the air. Could be from the water. It's been found in food. That's one of the heavy metals that's been found, like in fast food and school lunches and packaged foods. So I would say food, air, water, like you don't know. I talked to a mom the other day who, I think this was the kid who had high tellurium and thallium and something else. And she lives across the street from like a car mechanic where all these cars are coming in. Is there thallium off gassing? I don't know. And then the other side, she had something else on her. And they're living in this more toxic environment, So,
Right. And then tragically, also in
dark chocolate, you're right.
dark chocolate. Oh no.
Well, that's what I mean. It gets in food. And,
Yeah.
I think the reason it gets in chocolate is because in countries where they grow the cacao, they put it out on the road to dry. And then it gets all the metals from the exhaust, from the gasoline. I think that's how the heavy metals get in there. Or like same with coffee, then mold, mold is another thing that gets in there.
Yeah, yeah, and I think sadly it's just there's a lot of soil that's just so highly contaminated, and that's another way, especially with foods that can be bioaccumulators,
Well,
crazy stuff.
arsenic is
Yeah,
one of those, right? Because a lot of rice fields, we used to be cotton fields, and they used arsenic as a pesticide, so it's still there. So I see a lot of high levels of arsenic in the kids too.
I don't doubt it, I don't doubt it, and Jody, you're right, you gotta be really mindful about where what you're eating is coming from because of all of the stuff that is out there, which is
Well, I
almost
want to
getting to
say a
be.
little bit of good news
Let's hear
about
good news.
about that. So I live in the Pacific Northwest, and I was talking to a guy who works at Washington State University in way Eastern Washington, Pullman, Washington. And he worked in a wheat lab, a lab that would look at samples of wheat coming in from the country. And it was like some kind of assessment to see if it was saleable or whatnot. And I was talking about how Roundup is sprayed on wheat before harvest. And he said, it's not in the Pacific Northwest. So if your flour is grown in the high deserts of Oregon or Washington in the Pacific Northwest, it won't be sprayed with weed killer before
Woohoo!
harvest. Yes.
Okay, so we gotta see where to source that from. That's crazy good. Man, yeah, because that's a big problem. I mean, I think, that's perhaps the issue is that maybe there's not so much wheat sensitivity or gluten sensitivity as there is just glyphosate sensitivity.
Well, and I think of pets who are like, I don't have any pets right now, but when I did, like they would drink from the street, and what kind of oil mess was in there? Or, you're walking down the path and they drink from wherever. Who's spraying glyphosate? Is there stuff in the puddle? Like uh, animals aren't as picky. They'll just take what's there, right? So I worry about that.
I no, and I worry about it a lot, and the problem is that dogs, again, Environmental Working Group did a pretty big study several years ago, but dogs have something like up to 68 times our toxic burden, and cats have something like 93 times. So,
Wow.
I mean, we see dogs that for all intents and purposes that they behave as if they have autism, and that's part of why I wanted to bring you on. They can't figure out how to interact in a way we deem as appropriate. But this is a big part of why I believe is that their toxic burden is astronomically high. And if they came out of a hoarding situation or a disreputable breeder, then their toxicity levels are going to be even higher because they're being fed really poor quality food. They're housed in very unsanitary conditions. So they're recycling all their waste products. I mean, just
Mm.
yucky, yucky stuff. But I mean, there are so many parallels between what dogs and cats experience and what autistic children sadly experience as well.
Mm.
So, having said all of that, how do you generally work with a family or with a child? And is it a whole family approach?
Well, it has to be because, well, the whole family is affected. But I work mostly with the body of the autistic child. So we open up the body, we get them pooping, we get them really my aim is to pull toxins out before putting nutrients in, because a lot of times you try and put the nutrients in and they just come out in the urine. And of course, I teach them how to reduce toxicity in their home through their personal care products, laundry, cleaning products, what else is going on in the home. A lot of parents shut off the Wi-Fi at night and their kids sleep so much better. The parents sleep better. We oftentimes find mold in the house. So even though parents are like pretty sure there's no mold, I just did a test on someone that's like several mold toxins. Like, okay, and her other child is having problems. You got mold in your house, find it, um, and then there's, yeah, and then there's movement, and there's what you put in the body. It's not just about the food, but it's the clean water. How do you move? What's your mindset? How are you going about your day? So it's pretty holistic approach.
It sounds like it. And that really is amazing, because that's exactly what needs to happen. And with these guys too, we can look at, oh, your dog has leaky gut, and work on the gut. But if we ignore the rest of the pieces of the puzzle, so to speak, we're not going to get anywhere. So
That
I've got,
an interesting question is, do you advise your pet parents to turn off the Wi-Fi at night? And does it help with the pets? I don't know. Anyone out there, like, have you done that?
We've talked about it, and especially in reference to those smart plugs. I think we were talking about this at one of the conversations back at Mindshare or some other meeting, but there are these smart plugs. And so from your phone, you can turn the smart plug on and the lamp in your living room goes on. Well, there are plenty of reports of people using these, turning them on. They're at the level, at the head level of the dog and the cat. And the dog is like freaking out because all of a sudden it's feeling the electromagnetic frequency come out of this thing. And so it is a big concern. I mean, I have to agree. We turned off Wi-Fi. We, turn off our cell phones signal and keep them out of the bedroom as well. And that did help me sleep a lot better. And for her too. I mean, she is very sensitive environmentally. So if there is a Wi-Fi router in the bedroom in a place we're staying, we turn that sucker off. And I think we all sleep better.
Can I mention the thing we did at that hotel room?
Yeah,
how Hayo responded.
So cool.
So I can create what's called a heart song by putting heart rate monitors, like if you're getting an EKG on the body. And I did this with Ruth, and her heartbeat feeds into a box that creates a song based on her heartbeat. And Hayo was actually kind of agitated when you were on, because you were probably readjusting and going through things. But when I put you and your partner on, Hayo like passed out, like was just asleep and totally like no agitation whatsoever, because you guys were both really regulated with your heartbeat and regulated with your nervous system. And then I think you told me you guys all slept really well that night.
We did. And it was crazy because we had, I had been somewhere in that building. I don't remember if it was the room or somewhere else, but basically had a big fat mold exposure, which makes my brain do weird things. And so that process of doing the first soul song, I was able to physically hear what the dysregulation sounded like and use that to key in. But Mary Jo is the one that's chill and easy, and she can regulate all of us. So that was an amazing experience. And for those of you that don't know this technique, if you can find someone, if you're in the Pacific Northwest area, you can look Luminara up. But it's really, that was a beautiful, beautiful experience. So I've got your website in here where folks can reach you. Check Luminara out on her social media as well. Let me drop those in so you can see what she's up to. I can't recommend this enough as an approach to supporting children that have autism, but also I mean, thank you so much for this, because I think this helps all of us understand better um, how pets are being impacted and affected. And for those
Mm.
pets that have really massive behavioral issues, I think this is a lot of what's going on.
Well, and humans too, like adults too, I started by allergy elimination, and then we can do like pain relief. I remember practicing and working on my neighbor, and he had back pain and he had leg pain. And when I checked in with him a couple weeks later, I said, how's that pain down the side of your legs? And he goes, what pain? I said, remember you told me you had it. Oh, yeah, yeah, yeah. Oh, that's gone. And
Oh,
and
that.
then he said he was able to, sit in a car for an hour driving without having to get out. Normally he would have to, it was so painful. He couldn't sit for an hour.
Wow.
So it's not just allergies. It's not just autism. It's not just emotional stuff. It's like kind of holistic for the whole body and for everyone. And I'll just tell you a fun thing that I did on my garden. I was really mad that the slugs were or something was eating my strawberries. And so I did an NMT session on my strawberry patch. and then I can't remember what came up. Maybe there were toxins, maybe there was dysbiosis or something of the ground. And when I went out the next time to get the strawberries, there was like 50% less, gnawing away at the strawberries, which I was like,
Amazing.
wow. Yeah. So it's anything kind of alive.
That's crazy. So, yeah, and so the mycelium conduct the information in the ground, right? So maybe that was it.
Something. There's microbes, there's mycelium, there's roots, there's everything, the soil, the minerals, who knows?
Something going on. Amazing, amazing stuff. Wow. So thank you so much for coming and doing this and giving us this information, because I think it really is useful. And it is important for people to know that there are other ways to approach almost any problem. So for those of you that may have children that have autism or know someone, there is hope, because I know you have pulled several miracles out of your hat for families. So
Well, they do the work. I just guide them. I'm just their guide. And, you have to do the work and be motivated. And these parents are. So, yeah.
right on, right on.
Thank you so much for having me. It's been really fun chatting with
It
you
has
here.
It has been fun. Cool. So, for those of you that join us regularly, thanks so much for joining, for supporting, and we will see you next week with some new fun information. Until then, take good care. Ciao.